General examination. General examination includes general characteristics and vitals. On general characteristics, general appearance and pill code. In vitals, temperature, pulse, respiratory rate and blood pressure. General characteristics. The general characteristics include: first, look at the patient whether he is well or ill looking, consciousness, cooperation, orientation to time, place and person, built, lean, thin or heavily built, any noticeable features like any cannulas, catheter or other equipments are noted. Pallor. Pallor is the sign of anemia. It is checked at lower palpebral conjunctiva, for which we retract the lower eyelid downward and ask the patient to look upwards, both eyes at a time. Other sites for pallor are tongue, soft palate, nail beds, palms and general skin. ICTERUS. It is the sign of jaundice. It is checked at upper bulbar conjunctiva in the daylight. Sclera is examined by retracting the upper eyelids upward and asks the patient to look downwards, both eyes at a time. Other sites are undersurface of tongue, soft palate, palms and soles, general skin surface. Lymphadenopathy. The lymph nodes are palpated bilaterally, symmetrically and from above downwards. Lymph nodes in the neck are palpated behind the patient except occipital lymph node. The lymph nodes are examined in order: first preauricular, postauricular, tonsillar, submandibular and submental. Finally occipital. Other lymph nodes are cervical group of lymph nodes, axillary lymph nodes, epitrochlear lymph nodes, inguinal lymph nodes, popliteal group of lymph nodes, mediastinal group of lymph nodes. Cyanosis. It is of two types: central cyanosis and peripheral cyanosis. The central cyanosis is checked at tongue, margin and undersurface, inner aspect of lip, mucous membrane of gingiva, soft palate and cheek. The peripheral cyanosis is examined at tip of the nose, ear lobules, outer aspect of lips, chin and cheek. Clubbing. To check clubbing, bring the patient's finger at eye level, look tangentially, observe the onychodermal angle. If the angle is obliterated, that is 180 degree or more, clubbing is present. Fluctuation test. Patient's finger is placed on the pulp of examiner's two thumb and held in position by gentle pressure with tips of the examiner's middle finger applied on patient's proximal interphalangeal joint. The patient's finger now palpated over the base of the nail bed by tip of the examiner's index finger. Check for any fluctuation. SCHAMROTH window test. The fingers of two opposite sides are held against each other. In normal condition, diamond shaped window is present. If lost, then it is the case of clubbing. Edema. To check for edema, first inspect leg for any swelling. Apply firm pressure for few seconds over the shin bone with thumb. Now inspect and palpate the area for any depression. Dehydration. It is checked at skin for elasticity and by skin pinching test. In eyes for tears and sunken eyes. Mouth for saliva and dry mouth.
Pulse. It is examined for rate, rhythm, volume and character. Examination is most commonly done on radial pulse. Procedure. Apply 3 fingers over the radial pulse on right wrist. Use palp of finger to assess rate and rhythm. Count the pulse for 1 minute in beats per minute. Bilateral examination of pulse should be taken. Other sites examined are carotid pulse, brachial pulse, radial pulse, femoral pulse, popliteal pulse, posterior tibial and dorsalis pedis. Blood pressure. Generally examined in brachial artery, in arm. Procedure. Patient should be sitting or lying at ease. All clothing should be removed from the arm. Place the manometer and cuff on patient's arm. Brachial artery is palpated little above the cubital fossa and stethoscope is placed over it. Cuff is inflated up to 180 mm of Hg. Then slowly the air is released. When the first sound is heard, it is called as systolic pressure. Again, slowly release the air and at a point there is disappearance of sound, marking the diastolic pressure. This too should be done bilaterally. Temperature. It is checked in the armpit and mouth. Children and collapsed comatose elderly patients. The temperature can also be checked in rectum. Procedure. The thermometer is placed in the armpit and the patient is asked to flex his arm. After a minute, the temperature is checked. Respiratory rate. Generally examined in abdominothoracic area in which the movement is noted in a minute, that is breath per minute. In women and children, thoraco-abdominal movement is seen. Respiratory rate should be taken simultaneously while checking for pulse.